Whenever I was first diagnosed and put on medication, and I'm sure like many of you experience, there's a lot of, juggling and adjusting and try this and try this and try that and, up the dose, low the dose, whatever. And for me, it was a lot of that. And so finally, whenever they found something that worked, like I'm sure you've heard of Seroquel or quetiapine, the same thing. It's an antipsychotic that's supposed to regulate your, help you sleep and regulate your mania. And one side effect is that it's an antipsychotic, so it's very strong. And whenever I was first taking it, I literally slept for a week straight. I mean, I was only up for about an hour a day to like go to the restroom or something. I didn't eat, I just slept. So now once that I have it, I cannot get off of it. It will mess me up. But yeah, it's part of it.
So I've been on many medications in this 18 years that I've had this illness. The heaviest one I've been on so far is called Haldol. It's an antipsychotic. He started me on it, the doctor started me on it when I was in the hospital recently. And it is very heavy, very sedating. It slows me down mentally. It takes away my creativity. And it's heavy, but I know I can't switch the medication for up to 6 months because my psychiatrist said I need time to heal. So I have a couple months off work and then gradually going to return to work with the Haldol. And then eventually I want to switch to Latuda because I hear it has less side effects. I've watched a couple videos on here of people on Latuda and it sounds like people like it. So I definitely want to try it because it's a newer drug and hopefully there's less side effects. But I won't be able to try that for some time, so I got to stick it out with the Haldol.
Remember, everyone reacts to medication differently. We all have different chemistry in our bodies. And what may work for one person may not work for another person. Depakote was my first medication. I had terrible side effects. I felt like someone was attacking me, and I was itchy all over and could not sleep. Lithium, I had toxicity poisoning, and so I quit taking it. I moved on to the next medication, which was Tegretol, and I've been on it ever since for the past 6 years. No side effects with that one, but that doesn't mean that somebody else won't have a side effect to it.
The huge side effect that I hate with medications is weight gain. I've been subject to that. My first go around with antipsychotics, Risperidol to be exact, I went from 130 pounds to 190 in 6 months. That's 60 pounds, 10 pounds a month. From there, I've only gotten bigger. I used to be 130 pounds. Now I'm 150 pounds overweight. My last go around with Seroquel, I gained like 70 pounds in 2 years or a year and a half. And so I'm struggling to get that weight off. Now my doctors have me on weight neutral medications, but it's not coming off as fast as it was put on. So I have to be aware and physically exercise. Seroquel triggered diabetes and high cholesterol for me.
Medication side effects. Weight gain, weight gain, weight gain, among other things. Yes, exercise and diet will help with that, but let's face it, we don't all have motivation to do that every day of the week and follow a strict routine. We can try and try and try. Maybe some of us succeed, but many of us struggle with this. You also have other things like headaches or fatigue or tiredness, or for me, one of mine makes my hair fall out. Not to where I'm bald, but that you can feel the thinning hair because of the medication. But I take it because I'd rather be there than in the great depression that I was in 10 years ago that I refuse to go back to. I take the medication with the side effects just so that I can remain stable.
I take Vraylar and Seroquel. My Seroquel, I notice, tends to make me quite sleepy the next day. And I've been noticing I've been having trouble swallowing at night. Not my pills or anything, it's after I take the pill, after 30 minutes I seem to have trouble swallowing. But with the Vraylar, I got, dizziness, sweating, excessive, body heat. Nothing too worrisome, just normal side effects. Migraines, I don't know if I said that already. But I've also been on Latuda, and Latuda worked very well for me, except when I hit the medication cap to where I couldn't take any more. without it doing some serious damage to me. But I highly recommend Latuda. It helped me for almost several years, and it was wonderful. And if you do have insomnia like I do, please ask your doctor about Seroquel.
I think medication is one of the most important things to help you if you have bipolar, but there are several different side effects. It ranges from person to person. My side effects while I was trying to get on the correct medication and dosage and everything, my first one is I gained a lot of weight, and secondly, I was very, very tired with some of the medications. I seemed like I could not wake up or function with a lot of the different medications. Some pretty much threw me into a major depression or a manic episode. Those are the main ones that I've experienced.
Medication side effects are one of the biggest things that cause problems with bipolar. For example, I was on Latuda and I was literally a walking zombie, but it was the first medication that took away the hallucinations. So I didn't realize how much of a zombie I was until years later when I went off of it. Seroquel was another one I couldn't take because it caused me to shake uncontrollably to the point I was dropping things. And then sometimes my arms will jerk from medication.
Medication side effects for bipolar 1. It's important to remember that every body is different and every medication that you're given is going to react differently depending on your body. I was actually given the gene site testing whenever I was first diagnosed with bipolar. I did that on my own. It wasn't something that my doctor recommended, but it was something that a friend had recommended. So getting the gene site testing is going to tell you what medications are green light, which means are the best for your body. I was actually on medications that were only giving me the side effects and not the benefits. So it was actually making me very zombie-like and feel very dulled. So if you feel like your medications are dulling you and you feel like you're sleepy all the time or it's just not quite right, ask your doctor about getting the gene site testing. It's really easy to do and it can give you an insight on what helps you the best.
Another side effect of medication is that I feel like it stifles my creativity. It makes you feel a lot more fuzzy than you're used to. I used to write a lot. I was very creative and artsy, and I don't have that in me anymore. And it makes it very tempting to try to stop taking my medication because I want to have that back. But I have to remember that my life falls apart when I'm not on my medication. Everything falls apart. Job, relationship, family ties, everything. So I have to remember that I have to outweigh whether it's worth it or not. And I can still be creative. It just takes a lot more effort, and that's okay. That's not going to discourage me from trying. I've been on bipolar medication for 16 years now, and I've noticed a lot of different side effects that weren't pleasant. I've switched medication a lot, trying to find the right one. The medication that I've taken has affected my memory. It has made me feel not as smart as I used to feel because it makes your brain a little fuzzy sometimes, but it's better than the alternative of being extremely depressed or extremely manic and the effects that takes on your life. Right now I'm in a good place with my medication. There's been a little bit of weight gain, but it's worth it for, everything that it is keeping me from. And it's very easy to stop taking your medication. It's very tempting, but it's better than the results of not taking your medication.